Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting into our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, courses, tools, review books, as well as videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate in all of our courses and a 100% pass rate in our one on one sessions. Now, my disclaimer, you guys, we know there's no absolutes in medicine. We treat on a patient by patient basis. Any of these questions, I have designed them based on the guidelines that are currently being tested on the ANCC as well as AANP. So, if I am talking about videos on what we currently do in practice, I will always say that so there's no confusion, okay? So, with that being said, let's get into question number one for today. Question number one states, a patient presents to the office today with complaints of a sore throat and fever. Upon examination, the nurse practitioner notes tonsillar exudate and anterior cervical lymphadenopathy. Vital signs are 118 over 72 for the blood pressure. The pulse is 64 beats per minute. Temp is 102 and respirations are 20. Based on these findings, what is the best differential diagnosis? Is it A, mononucleosis, B, strep throat, C, COVID 19, or D, influenza? Take a minute and tell me what you got in the comments, y'all. Tell me what you have. Don't be shy. Walk through it. Let's see what you have. What are you thinking? All right, I always recommend reading the stem of the question first because it slows you down to ensure you're answering what is even being asked. On that test, on boards, on exams, you don't want to rush through and make simple mistakes causing you to miss things that you know the answer to, right? We need all our points. So slow it down, read the stem, and make sure you're answering what's being asked. So the stem of the question here states, based on these findings, what is the best differential diagnosis? All right, so we're talking diagnosis, we need to run it back and look at our assessment, right? So, all right, subjectively, the patient presents to the office and they're stating they have this sore throat and fever, right? Okay, so then the nurse practitioner does their assessment. They're noting tonsillar exudate and anterior cervical lymphadenopathy. And when we look at these vital signs, everything else looks pretty good, but that temp is elevated, so they still are febrile, right? So let's think about what it is. Sore throat. We're thinking about all the things that are our differentials for sore throat. But some of the key findings here is that anterior cervical lymphadenopathy. We know that's classic with strep throat, the sore throat, and the tonsillar exudate, and the fever. Um, those are common things, with mononucleosis. Although they have the sore throat, they may have fatigue. They have the posterior lymphadenopathy. Okay, so the best answer choice here is B, strep throat. Anterior cervical lymphadenopathy. Remember, like with strep throat, they'll have typically a fever. There's no cough associated with that. Sore throat, they have the tonsillar exudate and anterior cervical lymphadenopathy. All right, question number two for today. A patient presents to the office today for follow up. The patient denies any complaints at this time. No medical history is noted. Vital signs today are 124 over 70, pulse is 66 beats per minute, temp 98.6 degrees, and respirations are 20. Upon assessment, the nurse practitioner notes the review system is all normal. Based on these findings, how should the nurse practitioner treat? Is it A, advise the patient to start the DASH diet and exercising 5 days a week for 30 minutes each of those days? B, advise the patient to follow up in 2 weeks. C, prescribe chlorothalidone. Or D, nothing is needed at this time. Have the patient follow up in 4 weeks. Take a moment and tell me what you have. What do you think? What do you think? All right, so let's read the stem of this question. And y'all, if you are sitting down and working through this, if you are listening to it on your ride or anything, and you're trying to think through and process it, pause the video, look at what it says, think through what I'm saying so that you can walk through it and answer, okay? All right, so stem of the question states, based on these findings, how should the nurse practitioner treat? All right, so if we're asking treatments, we need to run it back and see what our diagnosis is, what our assessment findings are, right? So the patient comes in for follow-up. This is just a standard follow-up appointment. The patient doesn't have any complaints. They don't have a medical history. So a healthy patient, vital signs look pretty good, right? Um, and the review of systems by the nurse practitioner states that they were all normal. So what are we treating here? Well, I want you to pay close attention. So the vital signs are in a normal range, but if you look at that blood pressure, 124 over 70 is exceeding our standard goal range of that 120 over 80. So even though this person is healthy and we have all these things, this is when you want to start having that talk about those lifestyle modifications and implementing these things, right? Hey, I know I talk to you about this all the time, but I need you to incorporate lifestyle modifications. We don't want this blood pressure increasing anymore, okay? The DASH diet where there's low sodium, and exercising, the recommendations of 150 minutes a week or 75 minutes of high intensity exercises. So that typical 150 minutes is 5 days a week for 30 minutes each of those days, and you can break that down into increments. That is your best answer choice. You want to throw in those lifestyle modification because this is considered pre-hypertension based on the ACC and AHA guidelines, okay? And I wanted to really throw in this style question because I get questions in our one-on-one sessions about, we know this, but trying to understand when to implement for testing purposes. So here's an example for you, okay? All right. And lastly, question number 3 for today. A patient presents to the office today with complaints of a yellowish let's start from the top. A patient presents to the office today with complaints of a yellowish vaginal discharge. Upon examination, the nurse practitioner notes a strawberry cervix. Based on these findings, what is the best differential diagnosis? Is it A, bacterial vaginosis, B, trichomonas, C, chlamydia, or D, gonorrhea? Take a moment and tell me what you have. All right, so step of the question states, based on these findings, what is the best differential diagnosis? Again, we're talking diagnosis here, so we need to run it back and look at our assessment. So this patient comes in and their statement is they have had yellowish vaginal discharge. That's your subjective, right? And then objective, the nurse practitioner notes a strawberry cervix. Now, here goes Brittany with her thing. When I say this, you say that. That is a key identifier. When I say strawberry cervix, you say trick, right? Trichomonas, right? So instantly, that's one of those things you should go straight to trichomonas. B, trichomonas is the answer. We treat with flagell, right? We know bacterial vaginosis, that's that you would think whiff test, fishy odor, treat with flagell. They can't tolerate flagell, we go to clindamycin. I want you to think of those quick things. Chlamydia and gonorrhea, they have that cervical motion tenderness. Gonorrhea may have a greenish discharge. Yellowish discharge is a classic for trichomonas. Yellowish discharge with the strawberry cervix, trick all day. B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. Make sure you meet me back here. If you need any of our services to aid in your study and helping you prepare for the exams in school as well as your boards, give us a call at 803-400-6864, or you can shoot a text to that number, 803-400-6864, or shoot us an email at thenursingstudio, the number 1 at gmail.com. Now, we have our review book, our ebook, and paperback option. Both are linked in the bio. For your access, we offer self-paced courses online. We also offer our 5-week course. I have posted today. Y'all have been asking. Our next date is June the 10th for our 5-week intensive for FNP and AGNP to prepare for the ANCC as well as AANP exam. Currently in one, of y'all are doing amazing, but you will see the link. Go over to the post if you're interested in joining. Um, Limited space. I try to keep it at a limited size so that I'm able to adequately work with each one of you and where you have weaknesses, and especially on that last week where of the 5-week review is an individual week where I work and give you sessions and give you advice on where you are currently in your exam readiness. So if you have been wanting to join, take advantage of your chance to sign up for that. And then our one-on-one sessions, we offer one-on-one sessions. You can do it's based off of what you need. So either a weakness that you want to just focus in on, or our one-on-one session to have you go from unsuccessful to successful. So having a customized plan to walk through studying and walk through where you currently are, structure a plan for you, and work alongside with you until you test. Okay. So if you need any of those things, give us a call or shoot us an email. Happy to work with you guys. But as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.